Have you ever been sitting in a doctor's office and they mention the word biopsy and your stomach just does a little flip? Well, today we're going to pull back the curtain on all of that. We're going to walk through some of the most common dermatology procedures, from the very first thought to the very last stitch, so you know exactly what's going on.
Yeah, that one little phrase, right? We should take a look at that. It can definitely kick up some anxiety. But what does it actually mean? We're about to demystify that whole process for you. Let's dive in.
So, first things first, before a single tool ever touches your skin, there's this incredibly important first step. No good surgeon just wings it. The most critical part of any procedure, big or small, is the plan. It's the blueprint for everything that follows.
And this right here is the key thing to remember. It's so easy to call these things minor procedures, but you have to realize that anytime you make an incision, you are literally changing the body's natural architecture. And that demands some serious respect and careful planning.
So what exactly goes into that plan? Well, it all starts with you, the patient. The doctor has to think through a few key things. Are you someone who might bleed more than usual? How's your track record with healing? And maybe most importantly, are you going to be able to take care of the wound once you get home? All of these things shape the entire approach.
Okay, now for a really fascinating part of our own body's hidden map. Your skin, it's not just a blank canvas. It actually has these invisible lines of tension, kind of like the grain in a piece of wood. They're called Langer's lines, and they are the secret weapon for minimizing scars.
And here's why that's so cool. When a surgeon cuts parallel to these lines, the skin's natural tension actually helps pull the wound together. If you cut across them, the tension pulls the wound apart. So, working with these lines means less stress on the wound, much better healing, and a scar that's way less noticeable. It's just a brilliant way of working with the body, not against it.
So the blueprint is ready. It's time to get the tools together. Let's peek inside the sterile tray and see what a dermatologist has ready for a minor skin procedure.
Here it is, the standard setup. You've got your basics for numbing the area, for making the cut, and for closing it all back up. And of course, everything, and I mean everything, is sterile, right down to that little specimen jar that's going to hold the tissue sample for the lab.
Now this is a great example of form following function. Not all scalpel blades are created equal. The number 15 blade, see that little curve? It's like a fine-tipped pen, perfect for drawing short, precise lines. The number 11, though, that's a spear point. It's designed for one thing, a direct, straight-in incision, which is exactly what you need when you're draining an abscess.
Okay, plan is set, tools are ready, let's get to the main event. We're going to break down the 3 most common types of skin biopsies you're ever likely to hear about.
This table gives us a fantastic bird's-eye view. The big differences really boil down to how deep they go and what they're trying to accomplish. You can see a shave biopsy is super superficial, just skimming the top. A punch goes way deeper to get a full core sample. And an excisional biopsy, well, that's for taking the whole thing out. Let's look at each one. First up is the shave biopsy. This is perfect for things that stick up from the skin like a skin tag. And here's a neat trick. The local anesthetic actually puffs up the skin into a little mound, which makes the lesion a much easier target. Then you just hold the blade parallel to the skin and, well, you just shave it right off. Simple as that. No stitches required.
All right, next is the punch biopsy. This uses a little tool that honestly looks like a tiny cookie cutter. It's designed to take a full-depth core sample. But here's the really clever part. Remember those Langer's lines? The doctor will stretch the skin perpendicular to the lines before making the punch. So when they let go, that perfectly round hole relaxes into a nice little oval. And that simple trick makes it way easier to close with just a stitch or two, which means a cleaner, better-looking scar.
And finally, we have the excisional biopsy. This is when the goal is to remove the entire lesion, root and all. The key here is that specific oval or elliptical shape. That 3-to-1 ratio of length to width, it's not random. It's the geometric sweet spot that lets the wound close smoothly without the skin bunching up or puckering at the ends.
So let's switch gears a bit. Everything we've talked about so far has been about biopsies, which are for diagnosis. But sometimes the procedure isn't about getting a sample, it's about immediate treatment, like when you need to drain a painful abscess.
But, whoa, hold on a second. You can't just drain any abscess anywhere. These specific areas are considered high-risk zones. The central triangle of the face, for instance, has veins that drain straight back towards the brain. You do not want an infection spreading there. This is absolutely a situation for a specialist.
So for a standard abscess, how's it done? After numbing it up, that number 11 blade, our spear point, makes the incision.
But it's not enough to just squeeze it out. The doctor actually has to go in and explore the cavity to break up any little internal walls. They're called loculations. Think of them as hidden rooms full of infection. You have to break them down to make sure everything gets out. Then it's flushed clean and packed with gauze, which lets it heal from the inside out.
And this, right here, might be the single most important thing to know about this procedure. You never, ever, ever stitch an abscess closed. If you did, you'd just be trapping any leftover bacteria inside. You'd basically be creating a perfect incubator for the infection to come roaring back, probably even worse than before. That wound has to stay open to heal from the bottom up.
Okay, so the procedure itself is done, but the job is not over, not by a long shot. What happens next, the follow-up and the wound care, is just as crucial as the surgery itself for getting a good result. You know, after an abscess is drained, the aftercare is pretty hands-on. That packing usually has to come out and be replaced in a day or two. And the patient has to be on high alert for any warning signs, like the redness spreading or a fever starting. It's really a team effort between the doctor and the patient to get everything healed up properly.
So, as we wrap things up, let's go back to that first feeling of uncertainty. After seeing all the planning, the incredible anatomical knowledge like Langer's lines, and the specialized techniques for each tool, it becomes pretty clear, right? What seems like a simple little procedure is actually this amazing blend of deep science and, frankly, surgical artistry. It's a great reminder of the incredible skill hiding in plain sight. Thanks for joining me for this explainer.